Well, good morning, everybody. I'm Sam Melnick, Chief Communications Officer here at the Massachusetts Health and Hospital Association. And on behalf of MHA, welcome to today's Executive Insights episode. For over a year now, this has really been one of our favorite and most popular virtual events. So we are glad to be making our big return today for what is our 11th conversation with a local healthcare leader. Just a few logistics before we kick things off. We will be recording this session for those who aren't able to join us this morning, and all lines will be in listen-only mode. If you have any questions during the webinar, we highly encourage you to enter them into the chat feature. They will come straight to us, and we will do our best to address as many as we can during our time today. Following the webinar, we will also be sending out the recording along with a brief survey, so keep an eye out for that. We also want to take a moment to thank MHA's 2022 sponsors for their support in underwriting MHA's education programs. And in particular, I would like to thank today's program sponsor, Pfizer. A valued supporter of MHA, Pfizer is one of the world's premier biopharmaceutical companies and a leader to vaccinate the world against COVID-19. I will now hand it over to Bob Fontanelli, Vaccine Account Manager at Pfizer, to say a few words before we kick off. Bob, do we have you here? Well, you can see some of Pfizer's great work here, again, to vaccinate the world against COVID-19. And you know, we're all well aware of the work they continue to do in many areas of healthcare. Looks like Bob might have hopped off. Tim, I don't know if you want to hop in, or we can send it straight over to Steve. Great. Tim Temple from Pfizer.
Thanks, everybody, for having us today. Bob and I work as vaccine account managers at Pfizer Vaccines. And oftentimes it gets a little different as far as like what roles we serve, because different from the sales team, we focus on areas for improvement and addressing immunization barriers. The 5 columns you see there are areas of integration where a vaccines account manager would work on generating solutions around immunizations and health disparities. Currently, there's a dramatic change happening with pneumococcal vaccine guidelines. And we are deeply involved in the transfer, both EHR integration and workflow changes related to this adult change for pneumococcal protection. Definitely excited to be here today and would love to talk with you all around these areas of support. Our sales team works on product-related solutions. We work on implementation solutions and health disparities. So I thought I'd clarify that, just to know that there's several layers working at Pfizer Vaccines to generate better overall preventive care. Thanks for the time, and I'll send it over to Steve Walsh to introduce our speaker today.
Thanks very much, Tim, and thank you, Sam. Great to be with you this morning. And thanks for all the work that you're doing truly to vaccinate the world and get us back to some semblance and quality of life that we enjoyed prior to these very difficult 2 years. This is our first Executive Insights episode of the spring. With the spring always comes a renewed sense of hope, a harbinger of great things to come, and our healthcare community is certainly feeling more than hopeful than the last time we met. But we know that you all still have enormous challenges on your plate, and we are focused on how to build a better system coming out of the pandemic. Our guest today is at the very center of those conversations and decisions. His appearance with us could not be more well-timed. It's my pleasure to introduce Michael Dandorff, President and CEO of Tufts Medicine. Michael may be only a few years into his work in Massachusetts, but he is already regarded as a veteran of the Massachusetts healthcare system by us at MHA and by his counterparts across the state and the country. Mike took the helm of Tufts Medicine, then known as WellForce, back in January of 2020. The Tufts Medicine system includes Tufts Medical Center, Melrose Wakefield Healthcare, Lowell General Hospital, Circle Health, and other leading provider organizations. In his role, Mike unites more than 15,000 employees with one common goal: integrating academic medicine and high-quality care for the patients and communities they serve. Mike previously served as president of Rush University System for Health and Rush University Medical Center in Chicago, where he elevated the system's quality rankings and patient satisfaction scores to be among the best in the nation. Mike also spent 17 years in leadership roles in the University of Pennsylvania Health System. He's a member of our MHA Board of Trustees, and he's a leading voice for the stability of our healthcare system and its workforce. Mike, thanks so much for joining us this morning. Mike, to kick us off, tell us a little bit about your passion for healthcare and what brought you ultimately to Massachusetts.
Sure. My passion for healthcare actually started when I was pretty young. I grew up in northern New Jersey in a two-family house, urban environment. My grandparents lived downstairs, I lived upstairs, and my family had a lot of health issues. My grandmother had a stroke. My grandfather suffered from dementia. We had cardiac issues and cancer issues across my family. And my mother actually suffered from panic disorder and deep depression. And when I was in the 5th grade, she was actually admitted to a psychiatric hospital. So I was in and out of hospitals and nursing homes from a very young age. But what probably got me most interested in healthcare was a personal incident where in my freshman year in college, I was in a bad car accident on the New Jersey Turnpike and wound up in a hospital for 6 weeks. I had fractured 2 parts of my vertebrae, T7 and 8. I had a collapsed lung, my kidneys failed, and it was touch and go whether I was going to make it or not. And what I realized and what I learned through that experience was the importance of teams in healthcare, and not just the physician. The physician obviously was a central part of my surgery and my rehabilitation, but it was really an entire team of people that cared not only for me but for my family. And I often say that we have a privilege in healthcare that we get to take care of people at their most vulnerable points. And I certainly was there, my family was there in my own experience. And that we often underestimate the impact that we have on lives, because we're not just fixing people in a way, right? We create human connections with those that we serve and in the communities that we serve. And we just can't underestimate that overall. You asked what brought me to Massachusetts. When I first got the call about a role with WellForce, I wasn't even sure what WellForce was. But it didn't take long for me to, through my interactions with the board and with leadership here, that there was just an enormous commitment to making a difference in people's lives, and to thinking about how different parts of the ecosystem, we have an academic center, community hospitals, a home care organization, and hospice, a very large physician network of both employed and private practitioners. And they were already committed to doing more than just provide great medical care. They really wanted to focus on health and connecting with people personally, but also focused on the costs of care, right? The total cost of care, and thinking about affordability as a big issue that I'm sure we'll talk about at some point later. But those were all pretty important things to me. And we really talked a lot, even before while I was interviewing, about the importance of health equity. It's something that I became more passionate about working on the west side of Chicago, which is known nationally as having some challenges, and ways to start to connect with communities in a way that really sort of changes the construct and the health of those communities in a meaningful way. So I was just excited, and I continue to be excited about the things that we're doing.
I want to talk about Massachusetts in a minute, but you hit on really important issues. One is your personal story, and then on equity. So I just want to follow up. I know you pretty well, and I didn't know that story. So thank you for sharing it this morning. We talk about attracting workforce back into healthcare and the importance of healthcare in people's lives. Was it a calling for you? Do you bring that journey, that story to work with you every day?
I do. I bring a lot of those stories, right? I bring the personal story, not only for me, but my mom still suffers from mental health issues, and is still very active in care in a lot of ways. So I bring all those issues with me, right? You bring your history and your life story with you to work, and I think that's what I ask our leaders to do too, right? Is to bring their passions with them, and like I said, I think we have an enormous opportunity to make an enormous impact on the communities that we serve, and we just want to make sure that we're kind of bringing our heart with us, not just our business minds and our intellect, but really thinking passionately about the impact that we can have.
Maybe I know a little bit about your passion on behavioral health now, and also in equity. And I think that part of our team here, led by Dr. Churchwell, Dr. Betancourt, is doing some generational work on equity, and you're one of the leaders in our standing committee on diversity, health, equity, inclusion. And the question is, what's unique to Massachusetts? But are these things unique to Massachusetts, BH, the equity work that we're doing today? What do you see differently here than when you were working in other parts of the country?
Yeah, I wish I could say that it was a unique thing to Massachusetts and we can just sort of steal from other organizations and fix it quickly, right? But I think the whole country's struggling with these issues. And the behavioral health crisis has actually obviously gotten much worse throughout COVID, a lot because of isolation. It's hitting our younger generations. I have 3 20-somethings. This has impacted them. They've been pretty resilient throughout this era. But I would say from a Massachusetts point of view, I think one of the things that is an enormous positive is that healthcare is high on the list of our leaders of the state, and you don't see that everywhere around the country for sure, overall. And I think there's been a lot of innovation in the state. I go back to, I was in Philadelphia at the time, but we paid a lot of attention to, Romney Care in 2005, 2006, when there was really this intentional expansion of how do we cover more people? How do we get people insured and start to close some of those equity gaps in ways. And, those aren't simple things. It's not a piece of legislation that fixes everything, right? There's a lot of experimentation and iteration around those sorts of issues. But I feel anyway, and I've been really pleased with the leaders across the state that I've interacted with so far about their real commitment to these sort of complex, I'd say almost wicked issues, right? They're not just going to be solved by hospitals or even the healthcare systems alone. They're really going to require a significant amount of public-private partnership. I'd say, particularly on the health equity side, the one thing that I'm really proud of that we did in Chicago was find ways to connect with communities and community leaders in a different way. Because this wasn't just about how do we provide access or solve small aspects of health disparities. But it gets to those social determinant issues that are pretty much driven by poverty lines. And we see that, right? If people don't have access to good education or food or jobs, those are things that we're not going to solve, but we can contribute to the solution of in a major way. And I'm a big believer that this is where government and industry and healthcare organizations have to come together in a very different way than we have in the past. And, I've seen some of that in COVID here, is a very strong partnership between health system leadership, governmental leadership, your leadership, at the association level, and even industry sort of leaning in terms of how do we do things differently? Because I think that's part of our job is to figure out how do we do things differently.
Let's talk about that pandemic challenge for a second, but let's rewind. And you're interviewing for a job at then Wellforce. You've got the talking points down, right? It's a system that you want to integrate, that's value-based, and a chassis that's based on fee-for-service. You got all these great ideas. You get here, you figure out where the building is, and then the pandemic hits. I mean, how has that changed your ability to transform this organization in the most extraordinary of circumstances?
Yeah, it was certainly a trial by fire in a lot of ways, right? I would say, I was just saying this to somebody the other day, there's these last 2 years feel a little bit like I've been here 2 weeks, and in other ways, it feels like I've been here for 20 years, right? In terms of the speed of change overall. And, I think if anything, what COVID did for us, if there's a silver lining, was it started to accelerate our ability to work together across the organization. Certainly for my own part, I had to lean on leaders very, very quickly. And, the leaders across our systems, our presidents and CEOs were just phenomenal in terms of coming together in ways that they hadn't come together before. And really that translated across the organization to people building a level of trust that we are actually stronger working together overall. And after that first surge, we really started to dig in to what ultimately is our vision. Where are we alike, and how can we anchor to a common vision? And I remember thinking about this then, and really this is something that I've always thought about in my own career from a leadership perspective, is I started to get really focused on 3 main things. This is, it always comes down to sort of people, purpose, and performance. And while we were going through that pandemic, it was all about the people, right? It was how do we keep our people safe and save as many lives as possible? And everybody was aligned around that. Everybody was so focused on those 2 things, on that purpose that we had. And our people were phenomenal in terms of the way that they aligned around that. But we also measured our performance against that, right? Were we getting people in quick enough for testing? Were we securing PPE in a way that we viewed those as system resources and moved things around and weren't just thinking about each individual entity and their own individual success in a lot of ways. So I think we built a lot of trust. We got a lot of alignment very, very quickly. And, from a leadership point of view, I've always been a big believer in, our job as leaders is to sort of get people aligned, make sure that people are in the right roles, and then empower them to go do these phenomenal things. I haven't been disappointed in the 2 years I've been here, that's for sure, in terms of the work that has gone on here. And I think we've probably accomplished some things in 2.5 years that other organizations around the country have taken decades to get to in terms of the alignment of leadership.
Well, there's no doubt you've got an extraordinary leadership team, which I'm going to ask you about in just a minute. But before I get there, I guess the congratulations are in order, right? But I'm sure it wasn't without some pain. In the middle of all this, you decide on a branding change where you launch a new name in Tufts Medicine and you introduce Epic to the system. So can you just talk a little bit about the last month or the last couple of months and the changes that you're undergoing as a system?
Yeah, sure. These were things that became more public over the last couple of months, but things that were obviously long planning over the course of the last couple of years. I'd say on the branding side, where that came about was we started talking about that probably over a year ago, and we made this decision that when Wellforce was founded, it was really this idea that it was going to be a bit of a holding company and everybody was going to sort of operate their own organization and Wellforce would operate in the background. And I think the board and leadership sort of all agreed that we weren't getting the benefits of being a system. And in some cases, it was even frustrating, right? There were opportunities, but people got to opt out of certain things and they weren't sort of really aligned in terms of the execution. There were some good things that were happening and they were making some progress, but change is hard, transformation's hard, integration's hard. Otherwise, everybody would be doing it, pretty quickly. But when we got sort of really anchored on how we were going to start to really focus on improving health and trying to take the friction out of healthcare, and we really talk about how do we start to think about patients as consumers in a different way, and really take the friction away for them in a very complex, fragmented industry, and also take the friction away for the people that work for us, because we create a lot of bureaucracies, and we need to break those things down and make things easier for people. Even more so because of the resiliency and well-being issues that we're faced with COVID. But when we sort of anchored on that, their sort of common vision, that's when we started to talk about, are we going to continue to be a kind of business to business brand, or do we really need to evolve into a more business to consumer oriented brand? And when we did that, we started to talk about, okay, well, what's going to resonate? And we did some market testing, of our various names. And it wouldn't surprise anybody that Tufts, given the reputation of the university in particular, there was a lot of awareness around Tufts and the name Tufts. And so we ultimately evolved through a series of interactions with our board and our leadership team, that we settled on Tufts Medicine, as that was going to be our unifying brand. And that was going to be the way that we started to present ourselves to the market in a more clear way of what we stand for and what we're doing. And, we're in the early part of that communication journey in terms of, we've changed the name. Now we really have to build the brand, the promise behind the name, and start to communicate that in a meaningful way. But we use that integration and that work. We've really thought about integration from a purposefulness point of view, right? It's we're thinking about that in the context of what is going to make a difference in the lives of the consumers and communities that we serve and the patients that we serve, and what's going to make it easier internally. So the organization, when I got here, the organization was still debating a bit about, should they go to Epic? Should we go to Cerner? Which way should we go? And we decided to go to Epic, in large part because the majority of the market's on Epic, right? So, I give, again, our leadership team a lot of credit here of leaning in and saying, if we're going to bring Epic in, let's all go on Epic at the same time, which was a big feat. And a lot of people, I said this to our leadership team yesterday, a lot of people thought we were crazy to do this during the pandemic. And, we've heard from Epic that we're doing better than most organizations do around the country. A lot to do with our leadership team being really focused on what was it going to take. And it gave us an opportunity as we were building Epic to come together and build one instance of Epic, right? We brought clinical teams together, we brought administrative teams together, to really work on common workflows and common order sets and common ways to do things, again, with the idea that we're trying to make it easier for consumers and we're trying to make it easier for people that work here. And while everybody would love to just sort of stay the way that they were, do things the way they've always done it, this gave us an opportunity for them to participate in that change and really sort of take ownership of that. So it's a big milestone for us as part of our integration journey, which is going to take time. It doesn't happen overnight, but it's really accelerated things. And it's gotten people working together across the system in ways I don't think they have imagined that they would as well.
You've referenced your leadership team a couple of times, which is really a credit to you to build such an extraordinary team. And certainly I've had the pleasure of working with some of them, board members here, former chair Jody White, Joanne Marquesi, Michael Wagner, just great individuals and leaders in their own right. But what do you look for in a fellow leader? And any advice for some of the emerging leaders on the call today who want to make their mark in healthcare?
Sure. And I agree with you, Steve. These people are just amazing people. They want to make a difference. They want to have an impact in ways that are bigger than their role and their position, right? I've just been amazed with the people that were here before I got here, and some of the people that joined since I've been here, around these common goals. But there's probably 3 or 4 things that I focus on the most when I was assessing the team. And again, we got a very talented group of people. But first and foremost, in my view, is always around the commitment to servant leadership. This is something that I've really sort of developed a deeper and deeper appreciation over the course of my career, and not just talk about it, but actually think about how do you lead differently as a servant leader. And, the way that I view it is, I have, a dozen or so direct reports, and they report to me, but I actually work for them. They don't work for me, right? My job is to help them be successful. And they need to believe that their job is to help their direct reports be successful because they work for their direct reports, right? And if we can cascade that down to the front line of the organization, we're going to do some really powerful things and really sort of accelerate change. But it's not about them working for me. It's about me working for them, and cascade that through the organization. And there's a deep commitment that existed for many before I got here, but there's a deep commitment for people around that. I also think there just needs to be a passion for excellence. We have to produce results, and we're in a market where the quality of care and the expectation of consumers are really high. So we have to excel, and there's got to be a commitment and a passion to that. And I'd also say that there's this need for courage, right? To really start to challenge the status quo. It's really easy to make incremental improvements. It's not really easy to do something that's really transformational, and start to change the business model in terms of the way we get paid, as an example. Something that Jody White, you mentioned, has been passionate about up at Lowell General and the Lowell PHO, and working closely with the physicians there. And it's something that we're certainly committed to as a system, to move in that direction. But I had a board member a long time ago say, hey, in order to make an omelet, sometimes you got to break some eggs. And the reality is that's right. We don't do everything perfectly, but we work together. We work as a team. We support one another. But we have bigger ambitions, right? And in terms of the things that we want to accomplish as both individuals and as a team. And I'd probably add to that list of servant leadership, commitment to excellence, and really thinking about challenging the status quo, is we have to be extraordinary communicators. When you're going through change, you can't communicate enough. And so we spend a lot of time, are we keeping people aware of what we're doing and why we're doing it inside overall? And you asked about advice for emerging leaders and for others. And I think some of those things are all really important to everybody, right? And no matter what level of the organization we're at and where we're working through. But I would tell people to never forget that relationships really matter, right? We've had debates. Well, do we publish the org chart or not? I mean, who cares about an org chart? It's how we get things done, how we work together as an organization. And I would also remember that healthcare is probably the biggest team sport out there from an industry point of view. And we all have to work together, and that requires relationships. And no one of us is more important than all of us, so to speak, in a lot of ways. And so I think that's probably my biggest bit of advice for young leaders. I often say what we need in our industry, and I think what any organization needs really, is we need problem solvers. We can also find ourselves. We can often find ourselves, as part of an organization where we have a ton of problem finders. We got plenty of people that want to tell us what's not working, but we need problem solvers, and that's how leaders emerge. Is they bring people together to solve really complex problems.
It's really important advice, and a good conversation is one that you're longing for more at the end of it. And we're coming to the end of ours. Unfortunately, we like to keep people moving and on time. So just lightning round, a couple of quick questions for the audience to know you a little better. Last great movie you saw, or a favorite movie?
Yeah, my favorite movie is actually a Brian song back from the 70s. I'm not a
concert
big
you ever attended?
movie buff, but that's the big one.
What's your best concert you ever attended?
Without a doubt, Bruce Springsteen, 1985, Born in the USA tour, saw him in Giant Stadium with a bunch of friends. I'll never forget it.
You're such a homer from New Jersey. Jeez. And alive or dead, who do you want to have dinner with? Who's your best dinner date?
Boy, that's a tough one. I'd probably go with Steve Jobs. He revolutionized not only an industry, but in a lot of ways, the way we interact across the world, and wasn't afraid of disrupting his own business. And it'll probably a lot to learn from him, and he'd probably be a pretty interesting dinner date.
Michael, this has been really an extraordinary half hour. We could do it. We could do it all morning. I appreciate it. I hope those that are listening will reach out to ask you additional questions that are important to them, because you are truly a leader in our space, in our market, an incredible resource to me and our team here at MHA. Thank you for all you're doing at Tufts Medicine, for the Commonwealth, for the communities and patients you serve. Our time has come to a close. I want to thank everybody for your tremendous support, for joining us again this morning to hear a little bit more about one of our healthcare leaders in the Commonwealth. Michael's not only a great model for leadership, he's a tremendous advocate for patients and for the Commonwealth. We'll be keeping an eye on his work and the works of Tufts Medicine in the weeks, months, and years to come. Thanks again to Pfizer and all our sponsors, and most of all to you, our attendees, for being part of today's Executive Insight series. MHA offers great programming on a weekly basis. We encourage you to visit our website for more information on what we have in store. Our next session will feature Dr. Laurie Glimcher of Dana-Farber Cancer Institute, and that will be in July. So keep an eye out for those details. We're also gearing up for our big Spring Forward Leadership Conference in May, our first major leadership forum, and it will be back in person, as well as our next DE&I Best Practices webinar on maternal health in May. You can visit mhalink.org for more details and registration information. Thank you again for joining us for your morning coffee and for all of your support of MHA. Hope you have a great day.
Thanks, everyone.